Out blowing your diet. Good morning.
Hey, good morning, Scotty. Yeah, whenever you go to a tailgate party or a football party, there's lots of good food. There's big sandwiches and ribs, but if you're trying to eat right and fit into your skinny jeans, those are the things you want to avoid. So Teresa Price with Lifetime Fitness is here today to give us some tips on making some smart choices when we go to these football parties, because we've got a lot of season left. So we got a lot of parties to get to. And you say, let's start with picking some good proteins, because that'll fill you up too. That's a good place to start.
Absolutely. Choosing proteins. You know, a lot of times when we're out at the games, we're usually looking for like wings or sandwiches. So choosing some healthier protein options such as salmon or maybe a grass-fed beef burger or steak.
Or even a turkey burger would probably be good too.
Turkey burger would be great too.
Okay, what's that right there?
That one's a turkey burger.
That is a turkey burger.
Yeah.
Okay, good. All right.
We've got some beef here and we've got some salmon.
So the lean proteins, and you always say grilling is a good option too, because that can help add some flavor, and then that kind of eliminates some of the fat that you can eat too.
Yep, so grilling's a great option for making sure that there's some healthy foods prepared for you. If you are using a grill, you definitely can even use some marinades or some dry rubs to spicing it up a little bit too.
Yeah, here you have a Cajun seasoning that you can just rub on any of your proteins, because you say that'll give you the flavor that a lot of times you're looking for with condiments, and we don't realize those condiments, man, they pack a lot of calories.
They do. They really just pack sometimes a lot of sugars or artificial ingredients that you don't really need, especially if you're trying to stay healthy.
Okay, let's talk about the kale chips, because these are one of my favorites. Scott, not so much, but they're much healthier for you than, say, tortilla chips or potato chips.
Absolutely.
And they give you the crunch.
Just swapping it out. You can get these at a local grocer, or you can even make these yourself. There's other options and alternatives to the regular mundane chips too.
All right, and when when it's neck and neck and you're nervous and you just need to keep feeding yourself because your team is like barely going to pull it off, then some trail mix is a good option too. You could get a lot of protein and some good berries and stuff in there.
Yeah, you can make your own trail mix, or you can pick it up at the store. I love going to Sprouts and just putting some good healthy alternatives in there.
Okay, so this is a homemade trail mix. So good idea. And then the marinades, when we are choosing a marinade, really quickly back to that, what ingredients do we want to avoid? Because I know sometimes you can sneak in some calories there too.
Just check out the label, make sure there's not a lot of sugars or artificial flavors in there or too much sodium. You just want to make sure it's just kind of the most basic ingredients with your marinades.
Sounds good, Teresa. Thank you. And you guys, coming up at the 9 o'clock hour at about 9:55, you got to wash all this stuff down, right? So we're going to talk about some healthier drink options for you, because, you know, football, a lot of people like to have a cocktail or two. We're going to tell you what she thinks about that and maybe some better choices for you. That's at 9:55.
Boy, that's such a toss-up. Potato chips, kale. Potato chips, I don't know. I just can't do it. Thanks, Heidi.
Or we were talking about salmon chimichangas. Maybe we could do that. Hey, let's talk to you about the I-17. An update here. We had an accident that was blocking almost the entire freeway. DPS has moved it here to, it looks like the Gore Point. Not sure you can still exit the freeway here at 7th Avenue, but much better. All the lanes have reopened. Still looking at, though, a very significant backup out to the stack. Either give yourself some extra time or think about an alternate, either the I-10 or maybe you can use a local street to get to South Phoenix.
When a woman learns she's going to have a baby, she usually chooses between a natural childbirth or having a baby using an epidural.
Right. So now more and more women are turning to another choice. They're turning to laughing gas.
I had no idea.
Courtney Griffin has more.
Hey, good morning. So I'm not quite at the stage where I have to worry about this, but there's a lot of moms out there that are. So we have a new option for moms. If they don't want to get the epidural, don't want to do it the natural way, they can now do another form. And I'm going to bring in Dr. Merchant. He's board certified OBGYN. Tell us about this new form we're talking about this morning.
Well, this is an exciting new option we've got for pain control for pregnant moms during the labor and delivery process. It involves nitrous oxide. And I've got my lovely patient here, Miss Mindy, who's 37 weeks pregnant. And I'm just going to show you on ultrasound quick. We'll take a quick look at that baby. As you can see, the baby is going to be head down right there.
Hi, Mindy. How you doing?
Good. Almost there.
Yeah, so you having a boy or girl?
I'm having a girl.
Oh, congratulations. So do you know which form you're going to pick yet?
I'm definitely going to try out this form, the new form, so that I can get up and walk around still.
Okay, so there's a little baby looking all healthy in there.
There's the head. We're in vertex presentation or head down. And I can tell you a little bit about the more traditional forms that have been used for pain control during the labor and delivery process. You know, one option has been the epidural. This is going to be an injection.
Wow,
if we can demonstrate where this injection goes. This will be done by
Look at the size of that needle, though. Is that pretty painful when that goes in?
The patients don't complain of too much pain. It is a very thin needle, although it is quite long.
Less painful than giving birth, I would assume.
I think that's a safe assumption.
Okay, so let's see. That would typically go, what, in the back?
And the lower back would be administered by the anesthesia team, and that would give numbing medication in the spine, kind of numbing her legs. The undesirable side effects of this might be that she's going to be numb from the waist down, and that she's not going to be able to move her legs. And though the anesthesia won't go to the baby from an epidural, it will linger on for several hours after she actually delivers, so that might be undesirable. And that could be compared to IV narcotics, which are another option. We've got our syringe marked fentanyl right here, but there's a lot of different IV narcotics. These are given intravenously to the patient during the labor and delivery process, and these do travel both to mom and the baby, so there would be some undesired side effects, such as mom being nauseated or a little sedated. They are a little longer acting, and they of course do go to the baby as well, so the baby could be born not wanting to breathe or not wanting to cry as aggressively because it has those IV narcotics on board.
Wow, okay, so nitrous oxide is a good option for us.
Yes, so if I can demonstrate the machine, this is a patient-controlled option that goes along with our hospital campaign of bringing options to patients. This is completely patient-controlled. Mindy can give herself as much or as little of the nitrous oxide as she feels she needs, and it's very safe. The machine relies on Mindy keeping a tight seal of the mask around her mouth, so there's really no way that she could overdose, because if she were to become a little sedated and the mask were to come off her face, the flow would instantly stop. As well, because the mask includes a 50% blend of nitrous oxide and oxygen, she's actually getting more oxygen while she has the mask on her face than we are just breathing the room air, so there's no chance of being hypoxic. This is really a very good option for a mom that wants kind of a more natural approach to pain relief during the labor and delivery process.
A lot of good information, so no real concerns with that. Well, it's a great new option. Guys, what do you think?
Well, it's definitely something to talk to your doctor about. I can see the advantages.
I prefer the epidural.
You prefer